Rebecca.
Yeah, so Rebecca,
start.
hi Rebecca, John Wright.
Hello.
Good to see you again. I'm
Good to see you.
gonna introduce our speakers here. Good evening, everyone. Many of you know me as a former San Anselmo mayor and council member. I'm also one of the founding members, along with Renee Goddard from Fairfax, of the Ross Valley Healthy Community Collaborative that merged with the Twin Cities Coalition for Healthy Youth to become Marin Healthy Youth Partnerships, which we call MHIP. Founding members of the Twin Cities Coalition include Bob Ravazio in Corte Madera and Larry Chu in Larkspur. Larry and I are still on the board of MHIP today, along with Larkspur Mayor Gabe Paulson, who's here tonight. As a 501c3, MHIP is funded primarily through the federal Drug-Free Communities program, through Marin County Health and Human Services, and through other grants and contributions. Our organization continues to expand, and we recently added Southern Marin to our service area. I'd like to introduce our two speakers. Matt Willis was unable to be here tonight because he's away on a family vacation, so we're fortunate to have tonight Dr. Lynn Silver. Dr. Silver is a pediatrician, senior advisor at the Public Health Institute, and clinical professor at UC San Francisco. She began working on cannabis policy when Proposition 64 was passed, recognizing that lessons from regulation of other legal but harmful products were not being incorporated into state cannabis regulation. As the leader of the Institute's Getting It Right from the Start program, Dr. Silver has worked with local governments on crafting local cannabis regulations. She's currently working on cannabis legislation to protect youth and close regulatory gaps. Kelsey Fernandez is the executive director of MHIP and has been involved with us since 2012. She has a master's degree in counseling psychology, which she applies to public health and community wellness issues. She brings to our organization extensive knowledge and experience in the areas of substance use prevention, intervention, and recovery. She firmly believes that we can't treat ourselves out of our current addiction crisis. We need to do everything we can on a local level to prevent harm from substance use through community education, changing community norms, and policy efforts. She's a San Anselmo resident and parent of 2 children who attended Marin Public Schools. So Kelsey, is it you or Lynn that's going to start on this?
I'll start. Thank you
Okay.
so much, John. Thank you, Melissa. I'm going to share my screen. I have a presentation. Can you all see?
Yes, perfect.
Okay, excellent. So it's really great to be here with you all. Thank you for having us. So when it comes to prevention, MHIP, we feel like we know what works. We partner with schools, healthcare providers, county agencies, youth, parents, and all 12 sectors of the community. But we know that education, parental monitoring, and peer support is not enough. Policies are necessary for social change. Marin has been successful in adopting policies for tobacco control. It took more than education to reduce rates of cigarette smoking and ensure smoke-free air. And it requires a similar societal level approach for cannabis with local ordinances and laws. Marin policymakers have taken a strong stand against tobacco companies targeting youth. Before Marin's first tobacco retailer license ordinance in 1998, nearly half of retailers were selling to youth. And now it's in the single digits. We have our elected officials like you to thank for that. Marin's tobacco flavor bans added onto the TRL laws are so successful because there's a uniform countywide approach where 100% of local jurisdictions have passed tobacco flavor bans. Thank you all for that. And Marin voters also demonstrate that they really care about protecting youth from these products through overwhelming support of Prop 31. At 81%, Marin County had the highest percentage of votes supporting the state flavor ban. We have been successful in taking a cautious approach with cannabis policy as well. So far, cannabis has gotten a pass on the statewide level, so we have to act locally. Through local control, all of Marin's jurisdictions have taken steps to protect youth. MHIP collaborates with Marin residents for public health cannabis policies on community organizing, education, and outreach. Marin for Public Health worked closely with Sausalito residents to provide facts and transparency to the industry-backed Citizens Initiative on the November 2022 ballot. 77% of Sausalito voters voted yes on Prop 64, showing support for decriminalization, but 74% also voted no to the proposed storefront, demonstrating a need to be careful about what the community is inviting in. We feel like we have an opportunity here with cannabis to use the lessons we've learned from tobacco control from the start, so we don't have to spend decades trying to correct the mistakes. It is now my pleasure to turn it over to Dr. Lynn Silver.
Thank you, Kelsey, and thanks to all of you for having us here tonight. It's a pleasure to be speaking to leaders from a county that's been such a wonderful leader on tobacco control and on other health issues. I used to be your neighboring health officer in Sonoma County for a while. Our project at the Public Health Institute really, since passage of Prop 64, has been trying to develop and test models of better cannabis policy that can better protect youth, public health, and social equity. And that's a learning process that's going on across the country. We've worked with many jurisdictions across the state and across the country and in Canada on this work. And really it grew out of our concern that all those lessons that we learned from tobacco control and other areas were not being applied to the regulation of cannabis as legalization moved forward. Next, please, Kelsey. Next, thank you. First, what's a big positive? I mean, legalization, I think, has had one particular very strong positive effect. In California, we've seen a 96% reduction in marijuana possession arrests, and in what that meant for criminalization and large-scale incarceration of young people, particularly of color. That process of decriminalization and the automatic expungement of criminal records is probably the most important social equity benefit from Prop 64, much more so than economic equity in the industry, which has not been as significant. Next, please. Nevertheless, while we've seen some positive effects on the criminal justice front, there are many areas that are deeply worrisome, especially as a pediatrician and one concerned for the health of our children and youth. The cannabis industry is increasingly taking lessons from Big Tobacco's playbook. Just to cite three of the key examples, the potency of the products has been manipulated in ways that is greatly increasing the risk of addiction and of psychosis. The industry has created a very diversified and industrialized supply of cannabis products, many of which are clearly aimed at attracting kids. I call it sometimes the Coca-Colization of cannabis. So it's moved from this botanical product that many of you knew and loved in college to an industrialized, highly processed product with a totally different profile of risks. And that has been accompanied by shameless and misleading marketing of products, all things that characterize the actions of the tobacco industry for so many years. Next, please. This is just one article, recent article from the New York Times, citing how the changes in products have led to large-scale episodes of psychosis, addiction, severe vomiting, as weed becomes more potent and causing teens and young adults and some older adults to have serious health problems as a result. Next, please. So first of all, as our former Surgeon General said, it's not your mama's marijuana anymore. So the flower, when I went to college, was about 3 to 5% THC. Today it's 5 to 10 times as strong, about 15 to 30%. Our edibles are about 10 milligrams per dose, but a single can of a beverage may have 10 doses in it, representing a far excessive dose. Very different from what's the case in other countries. Vaping products can be up to 90%, concentrates like shatter used for dabbing up to 99%. So these are really highly concentrated chemical products that are leading to major increases in adverse effects in our kids and in our young adults particularly. Next, please. Just to give an example, this is a grape-flavored vaping cartridge with 380 milligrams of THC, but it looks like a memory stick that your kid would easily take to school. It has no smell, which makes it hard for parents or teachers to detect A single package of concentrate, small little package of concentrate, can have as many doses of intoxicant as a keg of beer, about 165 doses, intoxicating 12-ounce beer doses in one little package of many cannabis concentrates. Next, please. So why does this matter, and what are we seeing in terms of impact on our youth? Next, please. We are seeing rapidly emerging evidence of effects on cognition, on academic performance and social performance of use, dependence and addiction, vast increases in accidental overdoses and ingestions by young children, particularly children under 6. There's been a 1,400% increase nationally. And new things like cannabinoid hyperemesis syndrome, where people land in the emergency room with uncontrollable vomiting, for example, associated with heavy cannabis use. Next, please. Particularly worrisome to me is that these products with increased potency, and that's only over 10% in the research, which is almost all of our California weed, increase, if you use those products daily, it increases the risk of psychosis by 5-fold. And daily use of any cannabis increases the risk of psychosis by about 3-fold in major studies performed in 11 large cities. You know, as a former county health officer, and all of you as city officials and mayors, you know that we have huge problems with serious mental illness, that as a society, we are not managing that well, that we have large numbers of people living on the streets and with difficulties accessing adequate mental health care. So factors which increase the occurrence of psychosis, and this is not just transient psychosis with cannabis, it is also significant psychotic breaks and schizophrenia type illness, can contribute to raising the incidence of serious mental illness in a way that's just not a good thing for our society. And of course, a single or a couple of cases of serious mental illness can wipe out the revenue from cannabis taxes in a year. We are also seeing cannabis contributing to suicide in large studies from the National Institutes of Health, and about 50% of all teen suicides in San Diego County had THC on board. Next, please. The other area that really worries me as a pediatrician is use during pregnancy. This is our study with Kaiser Permanente in Northern California, looking at all the pregnancies over the past decade. Use over the past decade has almost doubled in Northern California women. And it's directly proportional to the number of retailers within a 15-minute drive from a woman's home. So if there's more than 6, it went up by about 30%. This matters because use during pregnancy is associated with low birth weight, prematurity, and other poor perinatal outcomes. But also, next please, more worrisome to me is recent data that's come out of a very large NIH study of how adolescent cognition is developing. And what they've been seeing, looking at thousands of children at age 9 and 10, is that children who were exposed to cannabis in utero had a much higher rate of certain forms of psychopathology, including aggressive behavior, social problems, obsessive compulsive behaviors, and psychotic-like episodes, even at 9 or 10. And these are not exposures that can be undone. Once that young child has that exposure, you can't undo that. Next, please. Cannabis use disorder occurs in about 9% of users, but in about 1 in 6 of those who start during adolescence. So starting during adolescence is particularly hazardous in many areas. Next, please. We're also seeing increased motor vehicle accidents, especially when co-used with alcohol. Next, please. Effects on heart health, including increased risk of heart attacks and stroke in younger users. Next, please. Overall, what this has led to is a large increase in emergency room visits. This is just a 3-year period between 2016 and 2019. We saw a 53% increase, 150,000 cannabis-associated ER visits in 2019, and a large increase in visits for psychosis. Next, please. So just to summarize that data, cannabis, even though it has some significant health benefits for specific uses, and more will probably be discovered, it is not a wellness product. Many of our youth are using this thinking that it's a safe, natural product to relieve their stress. when in reality, what they're using is no longer even the traditional botanical product that had some risks, but these new highly processed, much more potent cannabis products. Next, please. What's being sold out there? Next, please. You know, in your wonderful work on tobacco, you recognize that the tobacco industry had a kids menu and that 80% of kids were starting their tobacco, who used tobacco, had started with flavored products. Well, the cannabis industry has done exactly the same thing. They should never have been allowed to start with that, but they have. The state legislature and the voters have worked together to ban flavored tobacco. We should not allow it in cannabis. The state did take a baby step in that direction, but we need to go much further and not allow flavored vapes or products that are inhaled products that are described as strawberry, banana, vanilla, etc. Next, please. These products look very much like flavored Juul products look. They're, attractive, bright colors, flavored names, and so on. Next, please. In Marin, any 18-year-old with a medical marijuana card can buy products like these, sugary belts of high THC edibles, a single container of apple juice that actually has 10 doses, enough to get you very, very stoned if you drank the container, which is the normal thing to do. Products that are named after candies like Runts, Skittles, Girl Scout cookies. These should not be allowed. Next, please. As the director of the National Institutes of Drug Abuse said, when you legalize, you create an industry whose purpose is to make money selling these drugs. And how do you sell it? Mostly by enticing people to take them and enticing them to take high quantities. And that is exactly what we are seeing. Next, please. At least if we allow a for-profit path to commerce. These are just some of the branded merchandise that's out there. There's a major manufacturer called Cookies. They sell a smell-proof backpack so your teachers and parents won't smell anything, Batman t-shirts, and so on. And there's good evidence that exposure to this kind of merchandise increases use by young people. Next, please. We are also seeing a very serious problem with hemp products. So since passage of AB 45 in the state 2 years ago, edibles and other products with more THC than legal cannabis edibles are currently legally available to kids in shops across the state. Why CDPH has the authority to regulate that, they have not done so. And we are seeing products with as much as 1,000 or 5,000 milligrams in a package available in vape shops with no age limits. Next, please. This is a product I picked up in Woodland in December. It's dope Sour Patch Kids, cute little kids in bright color gummies. Each one of those has 100 milligrams of THC, 10 times the maximum allowed in a legal cannabis edible. And it was available with no age limits in local smoke shop. And I haven't looked for it in Marin yet, but I imagine it's similar situation. Next, please. These are more hemp products, one of them with 5,000 milligrams, 50 times the maximum allowed in legal cannabis. Next, please. So, to finish, I would just recall to all of you that under California law, local government has substantial power to act to reduce adverse effects from cannabis and to protect young people. Why still allowing legal access if so desired? Next, please. But allowing legal access should be balanced with policies so that we don't increase consumption and harmful consumption patterns, which is what we are seeing. And this is not rocket science. There are steps that you can take as leaders of local government to advance these goals. Next, please. This is just a survey we did of local laws around the state of California. This is on our website, and I'd be happy to share it with anyone who's interested. But just some examples, Contra Costa County was a leader in banning flavored cannabis products and vaping. Burlingame prohibited delivery to youth serving locations. Watsonville limited advertising, packaging, and products attractive to youth. Grass Valley is taxing cannabis based on the potency. El Monte is using their tax revenue for substance use prevention. Pasadena prohibited promotions and coupons, and so on. Next, please. And there are many wonderful examples of local innovation in this area across our state. So I will literally beg all of you as leaders of your communities to examine and to see what simple low-cost steps your city can take to make this situation better. On the left, there is a model ordinance that we developed for regulating local cannabis retailing and marketing for local governments. We have other model language on several issues that we're happy to share with you. Some examples are, you can require that every customer gets a health warning and a safer use file if they purchase cannabis, either by delivery or in a storefront. You can and should prohibit the sale of intoxicating hemp products right away, the ones that have THC that gets you high in it and that are currently being sold to kids with no age limits. You can further restrict the types of products that are attractive to kids that mimic common candies or flavored inhaled products, as you did for tobacco. We encourage communities to hold firm on the progress you have made on smoke-free air, not allowing your parks to become cannabis festivals and places where people are smoking at concerts and other public events, or to allow on-site consumption lounges, which go back to exposing workers once again to secondhand smoke. If you wish to allow retail in your community, we strongly recommend examining the model used in Quebec, which is a public monopoly, or using a contracted nonprofit to provide a legal access, but under strict rules set by the community. And there are other steps you can take to limit marketing, not allowing billboards, which some of you do already, I believe, and limiting other aspects of marketing. These are just a few examples. There are many more things that your local governments can do. Next slide, please. We are happy to work with you and work with the partnership and others to provide support. And what knowledge we've accumulated so far, it is a learning process. There's not a Bible of the best practices for cannabis. We've tried to pull together the evidence that is available and the learning that's occurred so far to suggest what possible best practices might look like to protect our kids. So thank you for the time, and happy to answer questions. We are your local resources, Marin Healthy Youth Partnership, the Public Health Institute, and others, and look forward to collaborating.
Thank you so much. We really appreciate it. Okay, we're going to take a question from the MCCMC members, and I see that Councilmember Hoffman has her hand raised. Go right ahead.
Hi, I wanted to, really not a question, sorry. This is more of a comment to, and thanks to Kelsey and her team and Lori Dubin when they came to Sausalito and really spearheaded a great campaign to educate people on the initiative that was in Sausalito. And I think that when people understood what that initiative was about, it was a resounding no on that particular initiative. So I'm really, happy that they came to Sausalito and that they spent so much time and effort educating our community. So, which I think was a good outcome for Sausalito. So, thank you.
Great. Okay, Pat Eklund, you have your hand raised.
Yes, thank you very much. Let me lower my hand. There you go. So, Lynn, great presentation. And I share a lot of your concerns. So have you looked at what the cities are sending out, the ones that have approved, like for delivery of these products? Have you looked at what we are permitting, what our permitting requirements and what we're asking them to do to see if it meets your standards? Not quite.
We have looked at, we have an annual kind of scorecard that we put out, looking at the regulations in each city and county in California that allows either delivery or storefronts. And we do have a database for the communities, at least through last year, and we're now updating it through January of this year. And we're happy to go over it if you want us to take a look at the rules in a specific jurisdiction and make suggestions.
Yes, I am.
We'd be
I
happy.
can't get my mic to work, so I can't speak.
Hi.
Um,
Hear you now.
So
we take over and vote yes.
I'm
can hear you.
competing with each.
Oh, I thought there was another one.
Okay, Okay, I just muted him for a second there, Pat. Go ahead, finish your.
Oh, thanks, Melissa. I wasn't sure
welcome.
how I was gonna get, because he has a louder voice than I do, I think. Well, I guess I'm just interested, I don't know what the staff requires in terms of what notices they have to give to their clients. I haven't actually looked at any of that. I'll have to ask, what is it that they require to distribute when somebody gets a permit to be able to sell to sell these drugs and deliver them. We do not have a storefront yet. I know that there is an interest in doing that, but that's very concerning to me. But it would be helpful to get some independent review done on that whole process, not just the regulations, but actually looking at what we give to the permittees and to see if it meets your requirements. And I'd love to, at least if you could send me, or if other people are interested, your rules, your draft regulations that you put out. I'd be interested in seeing those, and maybe just a link to your website so I could do some independent research. But thank you very much for all the work that you do.
Okay, I don't know if you can see it. I just put our website in the chat. We have local scorecards for all Marin County cities there. But that's just covers a few items. It doesn't cover everything. And we also have our model ordinance and other things up there. It's getting it right from the start.org.
Thank you.
And which city are you in?
Novato?
Novato?
Yeah.
If you reach out, we're also happy to look at that issue in more detail together with you in the partnership, if that would be helpful.
Great, thank you.
And I can help share all of the scorecards for each of the jurisdictions, because I do believe that getting it right from the start, they did look at the communities like San Rafael and Novato that are allowing delivery businesses from within the jurisdiction, and then looked at what those policies were and if they had any of the protections for youth, social equity, smoke-free air, those types of things.
Yeah.
Great. Thank you so much for being here, and thank you for your hard work on this issue. As Councilmember Hoffman mentioned, you were really instrumental to supporting us and getting through measure, the opposition to Measure K, which was really important, because when people understood what was really happening with that particular initiative, I think it was more of a clear answer. So appreciate all of the work that you're doing and everything you've done in our community and beyond, and the time that you've put in. And thank you very much. And we'll send out, if we can, send out your PowerPoint in the next packet, Rebecca. That would be really helpful, because there was a lot of great information in there.
Yes, thank you. Is that the same PowerPoint you sent to me earlier today, or were there any changes to it?
I can send it to you as a PDF. Yeah.
Okay, thank you. And I'll send that out, and I'll send the link to the scorecards out as well.
Fantastic. Thank you.
Okay. All right, great.